We're ready to begin, Chairman.
Okay, Denisha, would you do a roll call, please?
Yes, Chairman. Norman Boyd,
Here.
Roger Folsom,
Here.
Russell Crutchfield,
Here.
Anthony Williamson,
Here.
Nelva Lee,
Here.
Cynthia Rucker,
Here.
David Cruz.
Here.
Chairman, that concludes my roll call.
Thank you very much. We have a full complement of board members with us this morning, and thank all of you for taking your time for this special meeting today. We have a very full agenda, and we're going to move right into that in a moment. We're going to be asked as a board to consider 9 different areas for final adoption and 4 different areas for initial adoption as we move through. My first, I'll call the meeting to order, and my first comment, you notice in the roll call that Dr. Davis was not on the roll call. He had submitted a resignation letter to the governor's office and has left our board for some other opportunities that he has going on. With that, I thank Dr. Davis for his service, and I'll turn the meeting over for Commissioner's report to Commissioner Nagle.
Good morning. Thank you, Mr. Chairman, and good morning to members of the board. And I too will keep my comments pretty brief today due to the fact that we have a very full agenda today. And first, I just want to take a moment and extend my thanks and gratitude to our staff, Lynette Rhodes, Brian Lipton, Kim Morris, Brian Dowd, and others of the team and our finance team that have worked so hard over the past few months to get these 9 items that are up for final adoption prepared and ready, from concept to policy development, financial analysis, through the public comment period. Included in these final adoption measures today are the directed payment programs that we've talked about for a number of months, that if and once fully approved by CMS will represent a significant increase in Medicaid funding to the state of Georgia, to our hospitals, which will help us reinvest in our workforce, improve healthcare outcomes, and bolster and foster access to rural healthcare. So super excited about those, in addition to the other items that are a result of the state budget that passed and then will be effective on July 1. So very, very thankful for not only our staff, but some of our external partners, constituents and advocacy organizations and others that have helped us along the way develop these items. So thank you so much. Our RFI on CMO reprocurement closed on Friday. At this point, we'll take all of those responses that we received as a group and begin to review the feedback and the input that we got. At the same time, we'll be continuing to work internally, as well as scheduling some external meetings with our sister agencies and selected advocacy organizations to continue to get their feedback and input as we continue towards developing an RFP later this fall or early next year. So happy that that work continues. And then just one other update. Previously, we had submitted a disaster state plan amendment for nursing home rates for FY22 to increase those rates to the 2021 cost reports. And we did receive CMS approval on that disaster SPA recently. And so we'll begin our work to reprocess those rates in the coming weeks. And so happy about that. Looking forward to the presentations today, but happy to answer any questions. But again, thank you, Mr. Chairman.
Thank you, Commissioner. Are there any questions or comments from the board, please? Hearing none, we'll move into our first agenda item, which will be presented by Lynette Rhodes. And Lynette, you may make your presentation. Thank you.
Thank you. Good morning, Chairman Boyd, Commissioner Nagle, and members of the board. Thank you for the opportunity to present this morning. Pending Centers for Medicare and Medicaid Services approval, the Department of Community Health proposes to eliminate attestation requirements and reimburse all eligible providers at the enhanced rates for claims with dates of service beginning July 1, 2022 and after. The Affordable Care Act allowed enhanced rates for physicians with a primary specialty designation of family medicine, general internal medicine, or pediatric medicine during calendar years 2013 and 2014. The enhanced rates apply to both fee-for-service and managed care. The reimbursement rates mirrored the Medicare rates in effect during those calendar years. The codes identified in the final rule included codes 99201 through 99499, to the extent those codes are covered in our state plan. Subspecialists within the three primary care categories were also eligible for the enhanced rates, as well as non-physician practitioners, such as physician extenders or mid-levels, if they practiced under the supervision of an eligible physician. In order to receive the enhanced rates, physicians and physician extenders were required to attest that they met certain requirements outlined under the Affordable Care Act. They were required to attest that they were board certified in the designated specialties and subspecialties. Alternatively, physicians who were not board certified attested to having at least 60% of all codes billed for the previous calendar year for the E&M codes and vaccine administration codes specified in the final rule. New providers who were not board certified could attest that they had an expectation that at least 60% of their codes billed during the calendar year of enrollment would be for E&M codes and/or vaccine administration codes. The enhanced rates under the Affordable Care Act ended on December 31st, 2014. Subsequently, the department extended those rates as we were appropriated funds to continue those rates for an additional 3 consecutive years. Unfortunately, the enhanced rates were only allowed for those providers who previously attested under the ACA and for providers who were newly licensed and new to Georgia Medicaid as of January 1st, 2015. In the interest of equity, the department is eliminating the attestation requirements and is increasing the reimbursement rates of all currently enrolled eligible providers that failed to attest and that fall within the eligible specialty and subspecialty designations. This applies to physicians and physicians extenders. Newly enrolled providers that fall within those specialty and subspecialty designations will also receive the enhanced rates. An opportunity for public comment was held on May the 17th at 11:30 a.m. and written comments were due on or before May the 24th. We did not receive any oral comments. However, we did receive 4 written comments. The commenters were Dr. Hugo Skornick, President of the American Academy of Pediatrics, the Georgia chapter. Dr. Susanna Ajoy Alfonso, President of the Georgia Academy of Family Physicians. Dr. G. Walden Garris III, from the Georgia chapter of the American College of Physicians, and Dr. Bryce Gartland, the Group President and Co-Chief of Clinical Operations with Emory Healthcare. All commenters were in full support of the proposed change, as it will increase access in underserved communities, assist with the development and retention of physicians, and remove administrative burdens, ultimately helping and addressing the workforce shortage. In response, the department thanks the commenters for their written comments and their full support. One commenter reminded the department that the final rule also included 6 codes for vaccine administration. Those codes were 90460, 90461, 90471, 90472, 90473, and 90474. In response, the department acknowledges that these codes are included in the final rule, and to the extent that these codes are included in the state plan, attestation requirements will be eliminated. One commenter requested that the department consider including anesthesia services as a part of the physician supplemental payment program. The commenter indicated that at least 8 other states include anesthesia services in Medicaid supplemental payment calculations, to a full commercial consideration. While not directly related to the removal of the attestation requirements, the department does appreciate the recommendation and will take this under consideration at a later date. I will now pause for any questions from the board.
Any questions, comments from the board? Hearing none, is there a motion for approval for final adoption?
This is Dr. Lee. I motion to approve for final adoption.
Motion has been made for final adoption. Is there a second?
Cynthia Rucker, second.
Dr. Rucker has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Lynette, thank you so very much. Very,
Thank you.
very, very good presentation, and we thank you for all that work. Thank you. Next, Kim Morris has, I believe, 4 items for us to consider for final adoption. And so, Kim, you may proceed.
Good morning, Commissioner and Chairman Boyd. Today, I'm presenting for final adoption the increase for select obstetrics and gynecological codes to the 2020 Medicare reimbursement rates with an effective date of July 1, 2022. Total cost is $2,443,442 with state funds of $787,277. Included in your document is a list of the procedure codes, the current rates, and the 2020 Medicare rates. An opportunity for public comments was held on May 16, 2022, and written comments were due on or before May 23, 2022. There were no oral comments and several written comments. Written comments were submitted by Fred Foundry, President, Medical Association of Georgia, Susan Ajoy Afonso, President, Georgia Academy of Family Physicians, G. Walden Garrison III, Governor, Georgia Chapter of the American College of Physicians. All commenters were in full support of the proposed change to the rates. The department wishes to thank the comments for their written comments and support. At this time, I'll pause and see if there are any questions from the board.
Any questions, comments from the board, please? Hearing none, is there a motion for approval for final adoption?
Roger Folsom, motion for approval, Mr. Chairman.
Yeah, Mr. Folsom has made the motion for approval. Is there a second?
Russell Crutchfield will second.
Russell Crutchfield has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Kim, you may proceed to your next item.
Presenting for final adoption, a proposal to increase the mechanical ventilator per diem from $589.62 per day to $707.54 per day with an effective date of July 1, 2022. An opportunity for public comments was held on May 18, 2022, and written comments were due on or before May 25th, 2022. There were no oral and one written comment from Donna Knackers, Vice President of Reimbursement, Georgia Healthcare Association. Ms. Knackers expressed support of the increase in the mechanical ventilator per diem. The department wishes to thank Ms. Knackers for her written comments in support. At this time, I'll pause for any questions, and if there's no questions, I ask the board for approval for final adoption.
Any questions, comments from the board, please? Hearing none, is there a motion for approval for final adoption?
Motion for approval, David Cruz.
David Cruz has made the motion for approval. Is there a second?
Dr. Lee seconds.
Dr. Lee has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved, and you may proceed, Kim, to your next
Okay.
item.
I'm requesting, presenting for final adoption, a proposal to increase the reimbursement rate by 10% for long-term care acute hospitals and inpatient rehab facilities with an effective date of July 1, 2022. I've included in your document a listing of the long-term care hospitals and inpatient rehab facilities, their current Medicaid rate and their proposed increase rates. An opportunity for public comments was held on May 18, 2022, and written comments were due on or before May 25th, 2022. The department did not receive any oral comments, and one written comment from Carrie Summers, Chief Financial Officer and Executive Vice President, Georgia Hospital Association. Ms. Summers supported the 10% increase for long-term acute care hospitals and inpatient rehab facilities. The department wishes to thank Ms. Summers for her written comments and support. At this time, I'll pause to see if there are any questions from the board and request a board final adoption approval.
Any questions, comments from the board, please? Hearing none, is there a motion to approval for final adoption?
Dr. Lee motions to approve.
Motion has been made for final adoption approval. Is there a second?
Folsom, second.
Mr. Folsom has seconded that. All in favor, say aye.
Aye.
Opposed? Abstaining? Hearing none, you may proceed, Kim, to your final item.
Again, I'm presenting for final adoption, a request to increase funds for a 10% rate increase for 2 dental extraction codes and a 7% rate increase for 17 specific dental restorative codes with an effective date of July 1, 2022. This increase will impact the Medicaid aged, blind, and disabled, low-income Medicaid, and Peace Care for Kids programs. Included in your documents is a list of the dental extraction and restorative codes the department is requesting to increase. An opportunity for public comments was held on May 19, 2022, and written comments were due on or before May 26, 2022. There were no oral or written comments received. At this time, I will pause for questions, and if there's no questions, ask for final adoption.
Any questions or comments from the board, please? Hearing none, is there a motion for approval for final adoption?
Cynthia Rucker, motion.
Yeah, Dr. Rucker has made the motion for final approval. Is there a second?
Second by David Cruz.
David Cruz has seconded that motion. All in favor, say aye.
Aye.
Hey,
Opposed? Abstaining? Hearing none, it is approved. And thank you very much, Kim, for
Thank
all
you.
the work you put into this. Thank you. Next will be Brian Dowd, and he has, I believe, 2 items to present to us for final adoption. Brian, you may proceed.
Thank you, Mr. Chairman, Commissioner, and members of the board. I am presenting today for final adoption, establishment of a new service known as Behavioral Support Services. At the May 12, 2022 DCH board meeting, the Department of Community Health proposed establishing a new service known as Behavioral Support Services for children and youth under the age of 21. The service would become effective July 1st, 2022 with DCH board final adoption and CMS approval. Behavioral Support Services will be a standalone service within the Georgia Pediatric Program, as well as a key service included in a package of services that will encompass therapeutic services for children and youth. Behavioral Support Services are one-to-one, face-to-face behavior management intervention and stabilization services in home or community setting designed to teach and reinforce behavioral goals through training and direct support. The proposed July 1st, 2022 rate for behavioral support services is $6.63 per 15-minute unit, provided under the billing code S9122 with a U1 modifier. The rate change is estimated to increase expenditures in the age, blind, and disabled program in the amount of $17,079,021 in state funds, which will be funded as part of the American Rescue Plan Act initially, and then total funds of $53,003,402 in state fiscal year 2023. An opportunity for public comment on the proposed change was held May 19th, 2022 at 11 a.m. via Zoom. Individuals wishing to comment in writing on the proposed change were able to do so on or before May 26th, 2022. DCH received no oral or written comments. If you have any questions, I would be happy to answer them at this time and would respectfully request your final adoption of the establishment of behavioral support services.
Any questions, comments from the board, please? Hearing none, is there a motion for approval for final adoption?
Russell Crutchfield, motion for approval.
Russell Crutchfield has made the motion for final adoption. Is there a second?
Dr. Lee seconds.
Dr. Lee has seconded that motion. All in favor, say aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved. Brian, you may proceed.
Thank you, sir. I am also presenting today for final adoption a rate increase for skilled nursing services in the Georgia Pediatric Program, or GAP. The proposal is to increase the Georgia Pediatric Program skilled nursing by 10% effective July 1st, 2022. Code S9123 for registered nurses would increase from $10.63 per 15-minute unit to $11.69 per 15-minute unit. Code S9124 for licensed practical nurses would increase from $9.31 per 15-minute unit to $10.24 per 15-minute unit. The increase in rates of reimbursement is funded in accordance with the DCH American Rescue Plan Act, approved by the Centers for Medicare and Medicaid Services, and supported by ongoing state appropriations. The proposed reimbursement is estimated to increase expenditures within the Age Blind and Disabled Medicaid program for state fiscal year 2023 by an amount of $2,841,144 in state funds and total funds of $8,573,155. An opportunity for public comment was held on May 20th, 2022 at 10:30 a.m. via Zoom audio. Written comments were due on or before May 27th, 2022. DCH received one oral comment from Kai Yoke, the manager of government affairs at Biata. She identified herself and the GAP agency for which she worked. The commenter thanked the department for the rate increase, partnership, and the support of the Department of Community Health. She also asked in the public hearing to have clarity on two questions regarding the Center for Medicare and Medicaid approval of the rate increase and if the rate increase was to be retroactive. At the public hearing, Denisha Williams informed the commenter to submit the comments via email and the department would provide responses. The commenter did submit those requests and the department did follow up via a voicemail conference with the commenter to answer her questions. DCH also received 3 written comments from James Melicon, Vice President and National Director of Avena Healthcare, Tim Bowman, Chief Executive Officer of Advanced Care Partners, and Lee Dobson, the Area Director in Governmental Affairs, as well as Kai Yoke, the Manager in Government Affairs from Biata. The following written comments were received. All commenters thanked the department and the board for the proposed rate increase. The response of the department is to thank the commenters for their written comments and their support. All commenters expressed concern for the ongoing workforce shortage of nurses in the state of Georgia and expressed a need for Georgia to address the workforce shortage of nurses. The response of the department is to thank the commenters for their written comments and to note that the department is continually looking for ways to strengthen the healthcare workforce, including rate increases as proposed in this public notice. All commenters expressed a desire for a consideration of a rate increase in addition to the proposed 10%. The response is the department has proposed a 10% rate increase in accordance with its CMS approved plan and ongoing legislative support. So that's what we have planned for at this time. Two commenters expressed a desire for the rate increase to be retroactive to a date prior to 7/1/2022. In response, the department has proposed an effective date of 7/1/2022 in accordance with what was approved by the CMS, our CMS approved plan and ongoing legislative support. If you have any questions, I would be happy to answer them at this time and will respectfully request your final adoption of the rate increase for skilled nursing services in the Georgia Pediatric Program.
Any questions, comments from the board for Brian? Hearing none, is there a motion for adoption approval?
Cynthia Rucker, move for adoption.
Rucker has moved for adoption. Is there a second?
Crutchfield, second.
Russell Crutchfield has seconded that motion. All in favor, say aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved. Brian, thank you so very much.
Thank you, sir.
The next two items that will be, or three items will be asked to consider. The first two for final adoption and the third for initial adoption is Brian Lipton will make those presentations. So Brian, please proceed.
Thank you, Mr. Chair, and good morning to you and members of the board. The three items I'm presenting are all components of DCH's new Medicaid Innovation Advancement Project to increase available Medicaid revenue dollars through CMS approval of a series of state-directed payment programs, state plan amendments, and departmental rule changes. The overall project goals of all three of these items include leveraging additional federal Medicaid funding, supporting rural hospitals and bolstering rural access to care, reducing costs through appropriate level of care utilization, improving health outcomes and equity, and expanding healthcare training workforce investments. If all project components are approved by CMS, Georgia and the department will eliminate 100% or nearly 100% of uncompensated care costs at all small rural hospitals, cut the overall level of uncompensated care in Georgia by 50%, and reinvest approximately $50 to $100 million in its healthcare workforce. Moving into the first item for initial adoption, for final adoption, Medicaid Care Management Organization hospital-directed payment programs for private hospitals. Pending CMS approval, DCH proposes implementing a hospital state-directed payment program on July 1, 2022 for eligible private hospitals. Eligible private hospitals are defined as private acute hospitals, excluding general cancer hospitals, freestanding children's hospitals, and rehabilitative psychiatric long-term acute hospitals, and all critical access hospitals are also excluded. An opportunity for public comment was held on June 7th, 2022, and written comments were due on or before June 14th, 2022. No oral comments were received, and 4 written comments were received from the following: Carrie Summers, Chief Financial Officer and Executive Vice President of the Georgia Hospital Association; Bryce Gartland, Co-Chief of Clinical Operations of Emory Healthcare; Brian Church, Chief Financial and Administrative Officer of Phoebe Putney Health System; and Julie Bobnani, Chief Financial Officer of Colquitt Regional Medical Center. Commenters were in full support of the proposed changes, as it will provide a substantial federal funding stream to support critical hospital services and strengthen Georgia's healthcare workforce. With that, Mr. Chairman, I'm happy to take any questions. The department thanks the commenters for their written comments and their support. And with that, Mr. Chairman, I'm happy to take any questions and will respectfully ask for the board's favorable consideration of this item for final adoption.
Any comments or questions for Brian? Hearing none, is there a motion for approval for final adoption?
Roger Folsom, motion for final adoption, Mr. Chairman.
Mr. Folsom has made the motion for final adoption. Is there a second?
Dr. Lee seconds.
There's a second. Is there, all in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Brian, thank you very much, and you may proceed.
Thank you, Mr. Chairman. The next item is strengthening the reinvestment of the necessary workforce in Georgia, or STRONG. Pending CMS approval, DCH proposes implementing a new hospital state-directed payment program to focus on the stabilization, development, and diversification of the healthcare workforce, leading to improved health outcomes for Medicaid members. Eligible hospitals are defined as teaching hospitals with at least 5 resident full-time equivalents based on Schedule E, Part A, lines 10, 11, and 16 in the 2019 Medicare cost reports, excluding teaching hospitals participating in Georgia Advancing Innovation to Deliver Equity, or Georgia Aid. An opportunity for public comment was held on June 8th, 2022, and written comments were due on or before June 15th, 2022. No oral comments were received, and 4 written comments were received from the following. It was the same 4 individuals from the previous initiative: Carrie Summers of GHA, Bryce Gartland of Emory, Brian Church of Phoebe Putney, and Julie Bobnani of Colquitt Regional. Commenters were again in full support of the proposed changes, and the department again thanks the commenters for their written comments and for their support. And with that, Mr. Chairman, I'm happy to take any questions and will respectfully ask for the board's favorable consideration of this item for final adoption.
Any questions or comments for Brian, please? Hearing none, is there a motion for approval for final adoption?
Russell Crutchfield with motion to approve.
Mr. Crutchfield has made the motion for final adoption. Is there a second?
Folsom second.
Roger Folsom has seconded that. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Brian, you may move to your next item, which you're going to request, I believe, our consideration for initial adoption.
Yes, sir. Thank you, Mr. Chairman. The next item is changes to the disproportionate share hospital, or DSH, allocation methodology. Pending centers for approval, or pending CMS approval, the department proposes to update the definition of rural hospitals and revise the allocation methodology used to calculate hospital-specific DSH limits made on or after July 1, 2022. A hospital will be considered a rural hospital if the county's hospital is not in a metropolitan statistical area as defined by the United States Office of Management and Budget, or is in a county having a population of less than 50,000 according to the United States Census. Provided, however, that for counties which contain a military base or installation, the military personnel and their dependents living in such county shall be excluded from the total populations of that county. The updated definition of rural counties as having those population of 50,000 or less aligns with the definition in both OCGA 31-7-94.1, which provides for certification of rural hospitals for grant eligibility, and OCGA 31-8-9.1, which defines eligibility for rural hospitals to receive tax credits. The allocation methodology will be determined based on the level of directed payments to hospitals. If directed payments to hospitals exceeds 10% of total payments made to care management organizations, available DSH payments will be allocated such that eligible critical access hospitals, rural hospitals with less than 100 beds, and state-owned and operated acute care hospitals receive up to 100% of uncompensated care provided to uninsured and Medicaid patients. There is no change to the existing methodology if directed payments to hospitals are less than or equal to 10% of total payments made to CMOs. There's also no change to the amount of funds available for DSH payments under either methodology. This proposal only changes the distribution of those funds. The amount of funds available for DSH payments will be determined based on the state's federal Medicaid DSH allotment and required state matching contribution. And the state share of DSH payments amounts for state government and non-state government hospitals will come from intergovernmental transfers made on behalf of or by the hospital. And the DSH allocation methodology will be evaluated annually, subject to the level of directed payments to hospitals. There will be 2 opportunities for public comment. The first will be held on Wednesday, June 29th at 11 a.m. via Zoom. The second will be held on Wednesday, July 6th at 12 p.m. via Zoom. And individuals wishing to comment in writing or on the proposed individuals wishing to comment in writing on any of the proposed changes should do so on or before Wednesday, July 27th. And with that, Mr. Chairman, I will take any questions and respectfully ask for the board's favorable consideration of this item for initial adoption.
Any questions, comments for Brian, please? Hearing none, is there a motion for approval for initial adoption?
Motion for approval of initial adoption, David Cruz.
David Cruz has made the motion for approval. Is there a second?
Cynthia Rucker, second.
Dr. Rucker has seconded that. All in favor, say aye.
Aye.
Aye. Opposed? Abstaining? Hearing none, it is approved. Brian, thank you very much.
Thank you, Mr. Chairman.
The next area, we'll ask Kim Morris to return and present to us 3 items for initial adoption. So Kim, you may proceed.
Okay. Today I'm presenting for initial adoption pending Centers for Medicare and Medicaid Acceptance, a request to update the nursing home rates to the audited 2020 Medicaid cost report for all components of the rate file effective July 1, 2022. For state fiscal year 2023, the cost to update the audited 2020 cost report is an estimated decrease of $30,390,072. For state fiscal year 2024, an estimated decrease of $210,605. This change will be applied to routine and special services, dietary, laundry and housekeeping, plant ops and maintenance, administrative and general, general liability, professional liability, and property and related tax insurance. The department will update the rates annually using Medicaid cost reports and remove the hold harmless provisions from rate setting. An opportunity for public comments will be held on July 6, 2022 at 11 a.m. via Zoom, and written comments are due on or before July 13th, 2022. At this time, I will pause to see if there are any questions from the board.
Any questions, comments from the board, please? Hearing none, is there a motion for approval for initial adoption?
Roger Folsom, motion for initial adoption, Mr. Chairman.
Yeah, Mr. Folsom has made the motion for approval. Is there a second?
Cynthia Rucker, second.
Dr. Rucker has seconded that motion. All in favor say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Kim, you may proceed.
The department is requesting additional adoption from the board to propose a rule change to amend rules and regulations for medical assistance, Rule 111-3-14 ambulance provider fee. This change establishes a new ambulance provider fee program pursuant to the authority granted to the department in OCGA section 31-8-179.2 and OCAG section 31-11-31.2 as created by House Bill 271, which was part of the 2021-22 regular session. Such payments will provide the necessary funding to obtain federal financial participation for private ambulance providers pending Centers for Medicare and Medicaid Services approval. Provider payments under this proposed rule should only be used for the specific purpose of an ambulance provider fee. The provider fee amount should not exceed the amount necessary to obtain federal financial participation. Total cost for the rule is $18,180,482. A complete copy of rules 111-3-14 is attached for your review. An opportunity for public comments will be held on July 6, 2022 at 11 a.m. via Zoom, and written comments are due on or before August 11, 2022. At this time, I'll pause to see if there are any questions from the board.
Any questions or comments for Kim, please? Hearing none, is there a motion for approval for initial adoption?
Motion for approval, initial adoption, David Cruz.
David Cruz has made the motion for approval. Is there a second?
Roger Folsom, second.
Roger Folsom has seconded that. Is all in favor say aye.
Aye.
Aye. Opposed? Abstaining? Hearing none, it is approved for initial adoption. Kim, you may move to your next item.
Okay, today I'm presenting for initial adoption pending Medicare and Medicaid Services acceptance, a proposal to establish a new upper payment limit program for private ground ambulance providers that provide 911 emergency transport services to Medicaid fee-for-service beneficiaries. Total cost for the program is $28,590,7 $620. State funding via a provider fee is $8,769,315. The private 911 ground ambulance UPL is funded by a mandatory ambulance provider fee assessed to private 911 ground ambulance providers. The ambulance provider fee will only be used for the specific purpose of private 911 ground ambulance UPL, and the amount of the assessed fee should not exceed the amount necessary to obtain federal financial participation. Ambulance provider fees will be assessed on total 911 emergency transports for the following procedure codes: A0425, A0427, A0429, A0433, and A0434. The private ambulance UPL will be paid annually to eligible private 911 ground ambulance providers. Attached in your documents is a list of the eligible private 911 ground ambulance providers. This eligible list is subject to change throughout the duration of this program. An opportunity for public comments will be held on July 7th, 2022 at 11 a.m. via Zoom, and written comments are due on or before July 14th, 2022. At this time, I'll pause for any questions from the board.
Any questions or comments for Kim, please? Hearing none, is there a motion for approval for initial adoption?
Russell Crutchfield moves for motion for approval for initial adoption.
Crutchfield has made the motion for approval. Is there a second?
Second by David Cruz.
David Cruz has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Kim, thank you very much, and we'll look forward to after your public reviews and seeing the comments that come back, and thank you for your presentation.
Thank you very much.
With that, that concludes our items today. Is there any new business that anyone knows of that should come before the board at this time? Hearing none, making closing comments. I again like to add to what the commissioner said earlier and compliment the department for the amount of work and went into all of these different items today and financial analysis. And providing us the information in advance so that we had an opportunity to review before our votes today. With my back of the envelope kind of math, it's not very good, but I think I must recognize the amount of resources that the department is proposing here, and our state leadership has budgeted for in our state, and all of the things that we talked about. It's over $400 million of state funds going into enhancing provider networks to service our lower income population in Georgia. And that is very much appreciated. And it also allows us, and as a state, to access in total funding for the items we talked about today, over $1 billion. And that is quite significant. So with that, if there's no other comments or business to come before us, the meeting will stand adjourned. And our next meeting will be July 18th at 10:30. Thank you all very much for your participation today. Thank you.